Now, for the last possible cause of infertility in females, which we'll be looking at, is the possibility of some tumors being able to cause infertility in females. So, for the most common tumors, we look at fibroids, we look at this fibroids is spelled O before I, right? We look at adenomyosis, we look at what? Polyps, we look at endometriosis. So all of them, as we're looking at them, we're trying to establish the link between them and infertility in females, right? How they can be able to cause infertility. So, of course, they can cause infertility, right? So let's start. So fibroids, they are non-cancerous growth in the uterus. They can distort the uterine cavity. They can block the fallopian tubes, or maybe this place is now too narrow for an embryo to implant. Then we have adenomyosis, which is this. So adenomyosis, so that is endometrial tissues inside the uterine muscle wall. Can cause inflammation, of course. Something is there that is not supposed to be there. Uterine contractions, and all of that. The endometrial polyps, this is polyps. Of course, they are benign overgrowth of the uterine lining. They are just like fibroids. May block sperm entry or even disrupt the baby from implanting. Endometriosis, you are having in the endometrium tissues outside the endometrium place. Can lead to adhesions, inflammation. Of course, things are somewhere. They are good things, but they are where they are not supposed to be, making them bad. So all of them, in summary, they can cause infertility by either maybe blocking, inflammation, causing a disorganization in your hormone, sometimes making your immune system to now respond adversely. So you diagnose all of them through imaging, hysteroscopy and all of that. So treatment is, most of them you see that it is anatomical issues, right? So basically surgeries, myomectomy for fibroids, polypectomy for polyps. Then you can also do medical therapies, which is basically through manipulation of hormones, just to shrink the growth and manage the symptoms that usually come up with those tumors.